Good morning, everybody. It is time for the Orthopedic Minute and time to visit with a man who has a very interesting career to be able to do some things, especially if you're in the sports arena and maybe you've been injured in the field of sports somehow. There's a new way you can treat it that you might not have heard about. We have Dr. Mark Fox joining us. He's an interventional physiatrist, which is a title we have never heard of before, Jackie.
Now, we're going to sound really smart this morning, but to break it down for us, thank you so much for being here, sir. You have an interesting history when it comes to athletics and sports already before making your way here to Central Iowa. Tell us a little bit about yourself and what you've been up to.
Yeah, so grew up in Minneapolis and have been able to kind of go through different areas of the country with my training. Went down to Dallas at UT Southwestern. I worked with the Dallas Stars while I was down there.
Okay.
And then was eventually came up to Cleveland and worked with the Indians and the Cavs.
Did you really?
Yep. And back now here in Iowa, where I started my training at the University of Iowa for medical school. So we're really excited to be back in Iowa. My wife is from here, and bring what I've learned from all around the country back to the Des Moines area.
Now, you say you were working with these various sports teams. What was your capacity?
So I'm a sports medicine trained. I trained at Cleveland Clinic, and basically we are the team physician for these different teams. So we do anything from, injuries of the rotator cuff or the elbow for pitchers to, a player develops a rash or has some sort of ailment that they need antibiotics for while they're traveling with the team. So we kind of cover everything, and we're kind of a one-stop shop for the athletes.
And how can you use that knowledge and now bring that to what you're doing here in Central Iowa?
Well, when you're working with professional teams, you are lucky with kind of getting the newest and fanciest and most interesting technologies. And so I learned a lot about orthobiologics and the different ways that we can use them to help improve the healing process and get our athletes back out faster.
Okay, let's stop right there and let's explain what you just said.
That's good.
Okay.
So orthobiologics is a fancy term for basically what it is when you take a product from tissue, so it's obviously human tissue, but that's blood product or bone marrow product, and we can talk about this as well. And even some birth products like placenta, umbilical cord, amnion. These are all different products that are lumped under a term called orthobiologics, and basically it just means tissue products that are then used to help the healing process later.
Wow.
Can you explain that a little bit further? Because my brain's trying to wrap around what that all means. Because this is non-surgical, correct?
Correct. So these are they're minimally invasive approaches to get these products, and so the ones that you get from your own body is platelet-rich plasma that comes from your blood. So we just do a simple blood draw.
Okay, which is fairly routine.
Yes, fairly routine. And then for bone marrow aspirate, that's another very common one. What we do is we you lay on a table with an X-ray machine, and we just insert a needle into the bone. It sounds worse than it is. We use numbing medicine, obviously, and it's done in the clinic. No scalpels, no sutures. Small little hole, but that's about it, and you can go along your day.
So you extract some bone marrow, and then what do you do with the bone marrow?
Right. What is this helping?
Yeah.
So the orthobiologics, the bone marrow, the PRP, it's rich. This is where your stem cells come from, and that's commonly where the name stem cells came from. But it's rich in healing factors, in pain modulators, in all of the building blocks that your body needs to heal. And so basically we go straight to the source. We take it out, we spin it down in a centrifuge, get a high concentration
of it. So then you're concentrating it then,
Yeah. Yep. So we take, with PRP, it's generally 8 to 9 times the amount of those growth factors that you would have just in the blood, because we concentrate it down so much. And then put it into the place that is either injured or hurting.
Okay.
Yeah, so it's a very interesting idea, and patients love it, and it works really well.
So a natural ability of healing as opposed to just taking medications to kind of numb the pain. You're actually using things out of your own body to heal.
Exactly, and because it's natural and it's from your own body, the risk of a reaction or some of the side effects that come with medications, as you said, is very, very low.
So there wouldn't be any rejection because it's your own body.
Correct.
Yeah.
Now, the only trick with that is when you're getting into placental tissues. Obviously, those aren't your own body, but they're prepared in a way that's they're processed and they're sterile and they're frozen and preserved. So
what would that product be? That product that's extracted from the placenta, for example. What would you use that to help heal?
It's very similar. That's newer technology as well. So the research is still kind of not quite there in telling exactly what it works for and what it doesn't work for. In pitchers, we actually use it for tears of that UCL, that's the Tommy John surgery that we talk about. If it's a partial tear in a certain place, then actually the placental tissue seems to be helping heal that and avoiding surgery.
And what kind of increase in heal time is as a result of using these products?
That is a great question. Everyone's different. We try not to treat a single person based on kind of the research, but generally you would anticipate these are things that have been going on sometimes for months to years, and you can get them to heal when they otherwise weren't unable to heal. Or they're injuries, like with athletes, you're saying usually you can cut a few weeks off of an injury that maybe was going to be out for 2 months. You could get them down to 4 to 6 weeks.
Which is an eternity, time-wise,
yeah.
if you have to wait that long.
Yeah.
So again, if you injure yourself, a sports-related injury, you're using your own body, in most cases, to heal yourself.
I love this. It's less invasive than obviously surgery would be, but you're using a natural way of healing as opposed to kind of the epidemics that we're falling into now with over-medicating ourselves.
Yes, and it's again, we use numbing medicine for a majority of these, and if we don't, we do it under ultrasound guidance. So I use same thing you look for babies. I use it to know exactly where the needle is being placed and avoid all the painful things.
Oh, this sounds really neat.
It is neat, and it's amazing that this technology is making its way to Central Iowa, and you're a big part of that, Doc. So how can we learn more or get to meet you? Since you're new to the area, we want to welcome you.
Thank you so much.
How can people learn more?
So we have just started interventional physiatry clinic at DMOS in West Des Moines.
Okay.
It's me and another provider that focus on basically musculoskeletal conditions that either patients don't want to do surgery or they're not a candidate for surgery. We have a lot of different things that we can offer, like the orthobiologics. There's other aspects to our practice that can be helpful, but you can either just stop by, you can call in, set up an appointment, and I can go through a lot of this with you one-on-one. We're also working on getting some products, some handouts that basically can help answer some of the frequent questions, and they should be coming out pretty soon.
Absolutely fascinating.
Yeah.
It's nice to know there's some other alternatives out there, and we're able to sound very smart about a wonderful new technology. Appreciate that.
On the cutting edge, or not cutting edge.
There you go.
That's the whole idea.
Yep.
All right, DMOS.com to get more information. Do go and meet Dr. Fox. You'll be so glad you did. Thank you for that. That is really
Thanks for having me. Yeah.
Great information at 7:20 right now. And when we come back, we are going to celebrate you, so don't go too far.